Hello dear, welcome to my channel UNNIL UNMAI. I request you to like, share and subscribe my channel only if you really like it. And please do suggest some interesting topics in the comment section for my upcoming videos. Corona facts, everyone must know about it. We all have many questions about coronavirus, and many of us are really afraid to take COVID-19 test itself. So, in this video, we're going to see what are the symptoms of coronavirus, what to do about early symptoms, when to seek medical attention, how long does it take to tell your COVID-19 results, what are the treatment provided by Tamil Nadu government, and finally, what are the frequent questions which arose in the mind. 1. What are the symptoms of coronavirus? The most common symptoms of COVID-19 are the combination of at least two of the following symptoms: fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell. Apart from these symptoms, we might also have other symptoms of COVID-19, which include blocked nose, diarrhea, cough, nausea, vomiting. 2. What to do about early symptoms? If a person notices that they have symptoms of COVID-19, however mild, they should follow the below points. Self-isolate at home, keeping separate from others. Stay indoors unless seeking medical aid. Get plenty of rest. Stay hydrated with plenty of liquids. Take cold and flu medicine to soothe symptoms. Monitor symptoms and phone the doctor if necessary. Wear a face mask when around other individuals. Follow health department guidelines. Cover their mouth with a tissue when coughing or sneezing. Then wash hands with soap and water for at least 20 seconds. Wash hands regularly and thoroughly. Avoid touching eyes, nose and mouth with unwashed hands. Keep separate glasses, cups, dishes, eating utensils, towels and bedding if sharing a house with others. Clean and disinfect surfaces such as door knobs, counters, remote controls, phones, keyboards, bathroom surfaces or tables frequently. People who have symptoms of coronavirus infection should continue to self-isolate and follow these guidelines for 14 days, even if they begin to feel healthy. 3. When to seek medical attention? People who are experiencing mild COVID-19 will typically be able to recover at home without hospital treatment. However, around 1 in 5 people with a coronavirus infection will become seriously unwell and develop breathing difficulties. Anyone noticing the following symptoms should seek medical attention immediately: trouble breathing, constant pain or pressure in the chest, confusion, inability to wake up. A person with any of these symptoms or other symptoms that are severe or causing concern should call or go to the hospital immediately. 4. How long does it take to tell your COVID-19 results? Once if you tested for COVID-19 and your result is positive, then you will be getting a call from Chennai Corporation and they will take the patient to the nearby hospital in ambulance for the initial screening. If the patient is stable and looks fine, then they will allow to home quarantine the patients only if you have a separate room and bathroom facilities. Else, they will quarantine you in any of the schools or colleges for the mild cases. Whereas, if you have breathing difficulties or any other major problems, then you will be admitted in the hospital with all medical facilities for immediate treatment. Once admitted in hospital, no one from the family is allowed to meet the patients, and since then, the government will take the complete care of the patients. 5. What treatment is provided by the Tamil Nadu government? If you are hospitalized, then the government will initially take all possible and required testings, scans and X-rays. Based on the report, they will start the treatment for the patients. Only the serious cases require the ventilators, and even most of the serious cases will recover if they admitted earlier and treated on time. For all the mild to moderate cases, they mainly need complete rest and on-time food, along with the required tablets based on the symptoms which they have. In hospital, for these mild to moderate cases, they will provide the below list as a daily routine. Once you wake up, you will be served by Kabasura Kudineer, breakfast with egg, tablets if you have any, one orange fruit, lunch. In the evening, you will be getting soup, chickpeas, sundal in Tamil, followed by Kabasura Kudineer. In the night, you will be getting dinner. And again, if you have any tablets, then they will serve you. This is the daily routine continued until the patient discharged, and recommended to continue the same in home after the discharge for more 14 days by home quarantining the patients. 6. What are the frequent questions which arose in the mind? 1. Drinking alcohol does not protect you against COVID-19. The harmful use of alcohol increases your risk of health problems and can be dangerous. 2. Does cold or hot weather control the spread of COVID-19? No. The only way to control COVID-19 is staying away from others and frequently washing your hands. 3. Does the new coronavirus affect older people or younger people? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart diseases appears to be more vulnerable to becoming severely ill with this virus. 4. Are there any specific medicines to prevent or treat the new coronavirus? Till date, there is no specific medicines recommended to prevent or treat the new coronavirus. However, those who infected with this virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care as per the government guidelines.